So let me tell you a story. It was a sunny spring day, but my back hurt as I drove to my clinical rotation. My deviation in my upper back started to give me pain as an adolescent. Even thought I have learned to take care of my body, some days I just have pain. I had a wonderful mentor, Sarah Ansola, a Chinese medicine doctor. Every day when I arrived, she would tell me, relax, eat, no rush. When did I hear relax from any of my attendings in residency? Never. When she noticed my pain, she quickly said, take a break. Let me give you a treatment. A treatment? For me? Don't you have paying patients to see? I thought quietly in my mind. Let's face it, when in healthcare do you stop for an unpaying patient? Seldomly. She probably noticed my face and she said, don't worry, it's okay, I have time. I got ready in the room as I laid in the warm bed. And to my surprise, she returned with a heart-shaped cupping set. Pink hearts, I thought, so cute. Then she said, I want you to think about ways to love yourself while resting. Then she did her magic with the cups and the needles. I lay semi-naked in a warm bed, light steam, yummy smell in my body, relaxing music, asking how to love myself. When she returned, she said, remember to love yourself each time you see the hearts in the mirror. Have you ever had an experience like this? Perhaps if you were taught and a conventionally trained clinician, you were taught to keep distance from your patients. Working with Dr. Sarah taught me a lesson I want to share and invite you to put into practice. Creating a healing space for yourself and your patients. Have you ever wondered why the buildings designed for the sick are full of alcohol smell? It is also full of noises that elevate blood pressure, and lights might not even go out at nighttime, affecting the circadian rhythm of those we're trying to help. Nature at times is nowhere to be found, yet nowadays we're writing prescriptions for forest bathing. We design spaces functional for oversized wheelchairs and stretchers, but we do not create environments that foster healing. Then comes the emotional component of care. Maybe mental health clinicians ask their patients, how can you love yourself? But let's be honest, it's not something a lot of people in this room might ask, much less tattoo hearts on a patient's body. You may say, I have nothing to do with this. This is the responsibility of the administrators. But is it? My invitation is to learn spatial healing. Healing spaces are designed to nurture patients' physical and mental well-being by fostering environments of happiness and tranquility for the workers, the patients, and their families. Even your small office can be rearranged. You can bring in elements of nature. I wish I could bring my dog to work every day. Pet therapy for the healers and the patients. In the room where we examine patients, we can bring in more sunlight with small windows, skylights, or even stained glass while keeping the patient's privacy. Can we invite more silence and create a sense of safety for our patients? Or have relaxing sounds like water? Beauty should be everywhere, so why not have balconies with scenic views? And then comes the issue of loneliness. We don't want to spread germs, do we? Spatial healing is known for creating open spaces to foster interpersonal relationships. I was also taught not to use perfumes because I could cause an asthma or allergy attack. However, I have discovered that people prefer smells that are not pungent or musty. Aromatherapy enhances relaxation and fosters an environment of calmness. Often, the buildings designed for the sick are not conductive of healing, with alcohol smell, noise, inadequate lighting. It is often driven by budget constraints and a focus on meeting the physical needs of the patient while ignoring the emotional and spiritual aspects of healing. The result is that the place where people seek recovery may cause more illness. I learned that we should love ourselves while resting. I also learned that we can provide professional care while attending to the beauty of this space and the spiritual and emotional needs of our patients. By creating healing spaces of rest, we can help patients heal faster and more effectively. Lastly, let me share a quote from Healing, a Concept Analysis. Healing is a holistic, transformative process of repair and recovery in the mind, the body, and the spirit, resulting in change, finding meaning and movement towards self-realization of wholeness, regardless of the presence or absence of disease. Thank you.